Gentlewoman is recognized.
Thank you, Mr. Speaker. I rise in opposition to H.R. 3762, which would make getting health coverage more difficult and more expensive for millions of hardworking Americans. Today, 17 million Americans who had been uninsured now have high-quality, affordable health coverage. We should not overlook this fact. Across the country, people are now able to live their lives, to pursue careers, to start families, without the looming fear that any medical emergency could bankrupt them. The bill we're debating today would send our country back to a time when hardworking people couldn't access preventive services, when injuries and illnesses were not only physically debilitating, but could also be financially crippling. Imagine being diagnosed with cancer and fighting for your life to beat it, and then facing the prospect of losing your home because you're torn between paying a mortgage and paying for life-saving treatment. No one should have to face that choice. And what's especially disappointing is the fact that members of both parties have ideas for improving the Affordable Care Act that are worthy of consideration. We just heard one from Ms. Stefanik of New York. But instead of coming together around issues of common interest, the House is using its time to debate an unrealistic measure that would simply push health the reach of hardworking people in communities across this country, and yet again, on top of that, try to defund Planned Parenthood. So I urge my colleagues to join me in rejecting this bill. Let's get back to the table and work together. Thank you, Mr. Chair. Mr. Speaker, I yield the balance of my time.
The lady yields back the balance of